Pollution is one of the biggest causes of ill health globally. It harms the health of our lungs, our heart and our brains. Exposure to high levels of pollution can cause breathing difficulties and asthma. Exposure over the longer term can lead to chronic conditions such as cancer, stroke and heart disease. Many of these conditions would be entirely preventable if people could breathe clean air. Children whose lungs and brains are smaller and still developing are particularly vulnerable to the effects of pollution. Our local research in Yorkshire has found links between pollution and low birth weight in babies. We have found pollution to be linked to higher blood pressure and worse brain development in children as young as 5 years old. And the burden of this pollution-related disease is not equal. Families who live in more deprived parts of our cities have higher exposure to pollution and suffer greater ill effects, but they are least likely to contribute to high levels of pollution. Cars dominate many of our cities, and traffic-related pollution is the cause of 1 in 10 asthma cases in children. Substantial amounts of pollution also come from industrial sources and even from wood burning in our homes. Although there is no safe level of pollution, the World Health Organization has set some guidelines to help cities understand whether their populations might be at risk. In Bradford, as many as 191 deaths every year could be avoided if we cleaned up the city's air to these recommended levels. The social cost of pollution in terms of health and economic productivity is estimated to cost the UK £22.6 billion per year. Tackling pollution will not only improve the health of city dwellers, but will also help the economy. But how can we tackle pollution in cities? We should be encouraging urban and transport planners to work together with health and education providers, and crucially with communities themselves, to find ways of tackling the issue. Initiatives which restrict the movement of polluting vehicles, such as clean air zones, can help to reduce pollution. We need to prioritise walking and cycling. Communities need to feel confident that they can get around using public transport in order to ditch their cars. Public transport should be frequent, affordable, safe, reliable and sustainable. By working together at a regional and city scale, we can address the pernicious problem of pollution in our cities, and by doing so, we will create healthier, happier and more productive communities.